welcome to this next episode of Global Perspectives On, which is our format where we highlight different topics affecting Europe-Africa relations. Since we as Global Perspectives are a dialogue platform fostering the exchange of between Europe and European and African decision makers, and this is another way that we initiated to feature personalities, decision makers in different sectors from both continents, Europe and Africa. And I'm Rhoda. I'm one of the CEOs of Global Perspectives, and I will be guiding through today's discussion. And today we'll speak about women's health, a topic that can, I think, never get enough attention, and about how we can join forces to keep this important topic on the agendas and to discuss innovative or jointly develop innovative solutions to advance this important topic, and also to advance women's economic power through improved women's health and also family planning issues or measures. Family planning, which is of course not only a health topic, as we all know. I think this is we decided to cover this topic today because it's more important than ever to, as I said, bring it up on the agenda, recreate the momentum, because we are in challenging times here in Germany, discussing budget cuts. They're shifting political landscapes all over the continent. We see critical developments in the US, but also in France. So really important to not forget about women and women's health, of course, for gender equality, but also for economic growth, especially when it comes to the African continent. And for today, we've decided to focus a bit on the economic narrative. So that is often a bit overlooked. I think we've shared the most recent report of McKinsey on that topic beforehand. And McKinsey really highlighted that if we close the women's health gap globally, we can add up to $1 trillion annually by 2040 to the global economy, which is quite a number. So I think we're all on the same page that it is an important topic, and that we do not really need to convince each other about it. But we should rather discuss where we stand today, what have been recent developments in this context, what are best practices, but also what are gaps to be filled, and how we can all align our efforts and engagements in the context, also cross-sectoral, to sustain and accelerate the progress here. And what may be innovative solutions to leverage improvements in the field of women's health and family planning, and also new ways maybe to amplify our advocacy capacity. So therefore, we have two great experts here in the virtual room, as you can see. So there's Elia Zulu, Executive Director of AFIDEP, African Institute for Development Policy, currently based in Nairobi. Very happy to see you here again, Elia. We've worked together in the past, notably on one report or white paper that we co-developed last summer. I think more or less a year ago, you were in Berlin, where we discussed this paper on unfinished business in family planning. So also happy to hear developments in that regard in a bit. And you have, of course, great expertise in the research community, but also when it comes to collaborate or to governmental relations, and from different countries on the African continent, since you are closely working with the local governments there. And then we have Waida Bulhan, who is one of the leading voices of the African health sector and the African health space. She's leading the clinical operations for Sub-Saharan Africa at Roche. So you really bring in the private sector view and can share the global health companies and pharma companies, how they see this important topic. And then a bit later in the discussion, we'll have a short guest impulse sharing the multilateral view based on a very recent report that has been launched, but I'll introduce that then in a bit. In terms of housekeeping, for everyone in the audience, feel free to post your questions in the Q&A section, and we're happy to address them throughout the discussion and also at the end. And for you, Elia and Rhoda, please react to what the other person said. Feel free to just jump in. Let's make this as interactive and open and vivid as possible. So enough from my side. Let's just jump into discussion. We don't have too much time. So I would say, let's just start by, the first point. Where do we stand? What is from both of your perspective, the status of current developments when it comes to women's health, and maybe a bit also about family planning on the African continent, and where's the unfinished business, as we called it. So maybe Rhoda, if you would like to start.
Thank you, Rhoda, and greetings to everyone who's in the audience, and certainly to the co-speaker today, Dr. Elia. It's a pleasure to be back in conversation with the Global Perspectives team, and to take on this topic, which is near and dear to me, first of all, just because of one. So I'm speaking to you from Nairobi, Kenya, and as indicated, I work for Roche, giving you the perspective of not only an African woman who's experiencing a healthcare system here while in Africa, both as a practitioner and as a recipient, but also as an employee of an organization that is very, very global. So why is it important, right, to emphasize the need and the focus on women's health at the moment? I think it's widely acknowledged now that we have social beliefs and attitudes and behaviors around gender that have really dictated how women are regarded and treated within our healthcare systems, how we experience that care, and how this influences then health outcomes for women. I think not only has there been a data gap, but also women's health was treated in isolation and limited to just reproductive and sexual health matters. And really, if what we don't measure, we essentially cannot see. So, Rhoda, you talked about, the McKinsey report. And yes, we're starting to, I think, collate quantifiable information that is uncovering the scale of the problem in a different way, shining things in a different light as a whole. So, things like we have expected life expectancy that has increased. But why, despite living longer than men, women are experiencing more time in poor health? Why are women experiencing more side effects from different kinds of treatments compared to men? Why are complaints of pain from female patients often treated with a sedative or an anxiolytic as opposed to actual pain medication? And a perception that has continued over a long time that many health complaints from women are simply just psychosomatic symptoms. So, when you look at the scale of the problem, but also where the nuances of what is getting a light shined on at the moment, I think we're starting to uncover many different things. Of course, there's also sex-based differences, right, that play a tremendous part in all these factors. And so that combination of societal norms and biology has meant that women's lives and our well-being has been disadvantaged. And I think that is the point that is really coming across now in 2024 and gaining a lot of interest, but also a lot of potential then for collaboration. So I think what's really interesting as well is that especially around the world, but especially in Africa, women are the healthcare decision makers of families, right? And I want that to sink in for a little bit. It doesn't matter what education level you are at. Women definitely are the nurturers and the primary caregivers of families. And there's no argument, right, that we take care of everyone while putting ourselves lower on the list of priorities. But now we're starting to realize the implications of that sort of flow of how we are set up as families and societies. So I think we're at a turning point because now the conversation has shifted as to what this is actually costing us as humanity, right? And not just the human cost, which is where most of the conversation used to be around the moral imperative to do something. But now there's this whole big thing of an economic cost of neglecting women's health that has sparked a lot of interest, conversation, and debate. And because women are half the population of the world, and indeed even half the population as well in Africa, you know, from a private sector perspective, it also makes really good business sense. So that's where I'd pause and invite Dr. Elia to give his comments.
Go ahead.
All right, thanks a lot, Dr. Berger and the GTI team, Rhoda. I'm really glad to be here again today to talk about this important issue about family planning and its role in development. I think the key thing to note there being that women's health, as Dr. Berger said, is so critical, yet so it's actually the level of investment to make sure that we really leave no one behind as far as women's health is concerned is far below where it needs to be, both at the global level as well as at national level, where a lot of governments tend to, in Africa particularly, tend to underfund health. And in many cases, you have countries like Malawi, where it's estimated that over 60% of the health budget is funded by development partners. And when you look at family planning or reproductive health in general, you see that that number, especially on commodities, is going up to even about 80, in some cases 90%. So I think the point really we need to note is women's health, family planning, reproductive health is so central for development. And I think for a long time, we've made the rights argument, the argument that it's everybody's right to have to have access to full access to reproductive health services and reach their full reproductive potential according to their wishes. But this argument sometimes doesn't get to a lot of the people who make these big economic decisions, whether it's at global level or at national level in the governments. I mean, so I think that's the point we are trying to make here, that investing in women investing in family planning is good for for maternal health, for health outcomes in general. But I think more critically, it's also very, very central to the development prospects for the continent. That's why we talk about the concept of the gender dividend, the concept of the demographic dividend, that if we don't invest in people, we cannot reach the full human capital potential that the African continent has. And I think when you look at the issue, really look at it from the perspective of numbers. I'm a demographer, so I tend to like to throw in numbers there. The African continent now with about 1.5 billion people, and estimated to grow another billion people to be added in the next, by 2050. Africa by then will have about a quarter of the global population when it's at 2.5 billion. And there's no question that Africa's development potential would depend on what the continent does to turn this big population into quality human capital that can drive the development agenda for the continent, but also be useful population for the rest of the world, where some regions will start having labor deficits in terms of young people and so on. So I think when you ask the question, how does Africa then transform or translate this population into quality human capital, you cannot achieve that with a status quo where half of that population, roughly half of that population, women, are falling behind on so many respects, whether it's education, whether it's our health aspects, the levels of our teen pregnancies in many of the countries, where young people who should be in school, preparing to finish school and help develop the continent, are actually are losing those opportunities because they can't access reproductive health services. There is always contention about whether you should even teach in schools on sexual and reproductive health and so on. So I think the point here we have really to emphasize is that investing in girls, investing in women is really investing for the future. Is that it's not just a cost in a way that you can say, oh, we are just spending this money to make sure that the population is healthy. We have to optimize these investments to make sure that it's a central pillar of that effort of turning the African population to quality human capital that will drive the development agenda. And it's only through that we can lead to the SDG goal of saying that we are not leaving anyone behind. Because if we continue, I mean, women are disproportionately affected by climate change. Even when you don't throw in the issues about reproductive health, there's this huge debt burden now going on where many African countries, most of the money that they are even collecting in taxes, knowing that they have a very, very narrow tax base, is actually just being used to pay for loans that in many cases were even arrived at without proper analysis, without proper consultation to make sure that those loans were really good for the continent's development. So you're finding that a lot of countries are having this fiscal squeeze, right? These are the debt burden, there's climate change. Many countries still haven't fully recovered from the effects of COVID, the geopolitical war, conflicts. It's just making the cost of living across Africa so high. So in the context of that, it's easy for governments and for even the international development community to overlook health and think that there are other more important things that we should put resources to. And I think the point we have to note is that we cannot afford to do that, because not investing in women's health, not investing in reproductive health will put the continent even in a deeper hole when we look at 15, 20, 30 years from now.
And what would you say are main areas that we need to work on? And if you would have to choose 2 or 3 main areas that really needed to be tackled and to be prioritized, what would it be? And then the question of how do we do that? How do we increase the political will among local governments? But how can we also convince other players in private sector, but also in civil society, to get more engaged, and maybe also for all of them to collaborate closer? So maybe whoever wants to start, but what would be the main areas of work here?
Leah, do you want me to go? I feel like Dr.
You can go, yes. Go ahead.
Had his mic drop moment, it was like, if we don't do something major about women's health right now, and especially within the context of Africa, as African countries, we're losing the plot, I would say. So, thank you, Dr. Elia, for that. I think you really set the stage. It's gotten me going, and so Rhoda, just thinking about your question, things to ponder about. So we all agree that health systems around the world, even the ones in more advanced countries, have been failing women, right? And so women have been systemically overlooked and underrepresented. So when you think of gaps, you kind of really need to have a little bit of that broader view. And so where do we start? There's a lot of work that's going on by different entities around the world. As we've already shared and touched upon, it is a hot topic presently. I think from where I sit and the conversations that we're having with my colleagues and within the private sector is, how do we take a more holistic approach to women's health, right? And then have this embedded as a focus area across different parts of the healthcare system. And so that really forces us to take sort of a bird's eye view. We've touched primarily on contraception so far, which is really critical, right? Because it gives women the agency. I think that's the first thing that gives women agency then for the economic empowerment, but to really be able to chart the way forward and be decision makers. aside from that, maybe my invitation is for us to consider, let us look at the whole woman more holistically. So we can look at diseases that primarily affect women, which is what most of us are used to in conversation around when we talk about women's health. So it's things like maternal mortality, contraception, endometriosis, menstrual health, fertility, and a stretch into the oncology space around cancers that affect the female reproductive system. So breast cancer, cancer of the cervix, ovarian cancer. Second category is, we have diseases that predominantly affect women. And these are questions that we should also be looking at. For example, almost 80% of autoimmune conditions affect women. 3/4 of a condition like multiple sclerosis affects women, or Alzheimer's disease, disproportionately, predominantly affect women. And the third category to consider is, conditions that affect women differently. For example, heart attacks present differently in women. Why is lung cancer rising in women who are non-smokers, yet that rate is actually decreasing in men? And the illnesses and diseases that predominantly affect women or affect women differently certainly have an impact on the diseases that primarily affect women. So we cannot de-link, and we cannot, I think, no longer think about women's health just as, I think one person on a global stage said it's bikini medicine, right? And really just hone in on them. Because these other facets, these other entities that are taking place as well do primarily affect the other parts of the woman that are issues just for women only, biologically. So when you think of gaps, I would say, let's think about gaps either from a system perspective or from a patient perspective. And with that, we can look at, if there was two critical things, I would say is data gap, right? In the data that we have focused a lot, at least I would say from the private sector, on race and ethnicity. And that has been a focus area for the last few years, but we have very little data on sex disaggregation, right? So can we start looking at things from that lens in addition to race and ethnicity? So from that DE&I perspective, as we think of race and ethnicity, can we also think about gender? And the second thing is a care gap. Statistics are out there where as we interact with the healthcare system, 42% of women have experienced period shaming, right? This certainly affects health-seeking behavior. Women's pain is dismissed, as I mentioned earlier in our conversation. And I think there was a global report that also mentioned that in interfacing with the healthcare system, being dismissed and not being believed was a key theme for women around the world in their interaction with the healthcare system. So as we're thinking of women's health, we really need to think about data as a gap, but also the care gap that is there and the perceptions and impact that it has then on women interfacing with healthcare systems.
Mm-hmm. So Ilya, you're the data expert.
I'll just add there that I think the point really we need to keep emphasizing is making the investment case, and for us to make the investment case on Dr. Bohan, you just made the point that what is the cost of inaction for not investing in women? It's something that a lot of us who work in the field maybe is taken as something that is given, but there are a lot of people there who don't understand these issues. Those guys in ministries of finance who are making decisions on what proportion of money should go to agriculture versus health versus education versus the militaries and so on, need to understand that we all have these long-term development visions. Kenya has Kenya Vision 2030, Uganda has 2040, Malawi has 2063, Rwanda has a Vision 2050. I think we need to be speaking from the perspective of why not making these critical investments in women's health, in family planning, in productive health, is going to curtail the chances of actually achieving those goals. And I think when you look at research, there's a lot of research that tends to define the problem. I mean, how far behind women are. But not as much research that defines what actually needs to be done to address these issues, and then also what it will cost to get there. Later on, making the investment case, the modeling that is required to show that if you do such investments in women's health, this is what you get. We've all seen these statistics that show that investing $1 in family planning can actually bring a broader sort of benefits that could be the work that the Guttmacher Institute has been doing over this last couple of decades or so, that you'd get about $4 in return for that investment. And I think it's partly because of this investment, the modeling that was done around the demographic dividend, to show that, you know, if you would make this sort of investments, this is what you'd get in return. And that's what caught the attention of a lot of ministries of finance, a lot of even organizations like the World Bank, the IMF, the Africa Development Bank, to start looking at, you know, the importance of investing in family planning. So it's very, very important that we need to look at this. And also, when we look at the spectrum of looking at, okay, family planning, how does family planning end up actually helping in empowering women and contributing to development? That path is not that straightforward. My colleagues at AFIDEP, Professor Nyovan Madise and Dr. Na Dodo, are working with other partners on a project that is trying to actually estimate the economic benefits of investing in family planning. But their research that they've done a very, very comprehensive systematic review on what is already out there. And I think what is clear is that a lot of people tend to look at this from the narrow angles of saying, okay, family planning, what is its impact on fertility? There's research that shows that family planning has an independent effect beyond the socio-economic impacts of education or income that also lead people to change their reproductive preferences. But then what does fertility do? How does fertility, the changes in fertility, empower women? In what ways is it because you are able to start childbearing late that you also delay marriage and you end up having fewer children? And there's also the path of saying, how does that then translate to economic activity and to empowerment of women and to development in general? A lot of people tend to take these narrow pieces, and I think it's important that this issue needs to be studied more comprehensively so that you really see how these linkages are, and that the evidence is put on the table to really demonstrate the economic value of investing in women's health. So I think for me, that's one critical thing that I would say needs to be on the table. But also when you look at more generally the question about where are the big gaps, it's very, very clear that across Africa, the big gap is on adolescents and young women. That progress is being made. Young Africa is not making as much progress as the rest of the world, but over the last decade or so, and thanks to the efforts of the international community, the then FP 2020, now FP 2030 initiative that is trying to mobilize, you know, government's commitments and mobilizing global resources and so on, there's now a very, very well-defined progression across the continent. Last year, I think in the study we did, Rhoda, I remember, we did some analysis on how countries are moving forward, and 9 out of the 10 countries that had the most pronounced progress in improving contraceptive use were African countries, and not just in one region, across the whole continent. So I think we have to accept that progress is being made. We have to build from this the base of what is already being achieved, and look at what is really the last mile. And I think for the most part, you see that every country, whether it's those at high levels of contraceptive use or low levels, the big problem is how do we reach adolescents? how do we make sure that comprehensive sexuality education is accepted to be taught in schools? Of course, it has to be age appropriate. But for those young people who are sexually active, how do we make sure that they have resources? I think, to me, this is the big issue. And that's where also the private sector has a critical role to play, because a lot of these young people don't engage with the public health system. They mainly engage with the private sector, and the private sector can play a big role in making sure that they contribute to addressing the service gaps that we see.
This leads to another question: which stakeholders do we need to bring into the boat? Is it I remember last year we discussed that some governments, as you were just mentioning, some governments are doing some progress, some other governments are a bit behind. What are learnings maybe from some governments that we can replicate to other countries, but also what are other players that we need to address with these narratives that you have both just described?
I think I can just jump in maybe very quickly there, Dr. Bohan, to just say that I think for me there has to be it's a comprehensive problem. It's a cross-cutting problem. So really the people, the stakeholders who need to be tackled have to be contextualized. In some countries, you find out that there are people who strongly oppose some of these issues. It might be religious leaders. It might be, even people who are in government. It might be education leaders who don't want education spaces they don't want to open education spaces or learning spaces for comprehensive sexuality education. So I think it's where one has to map the context, look at the issues, do political economy analysis in each of these settings, and find out who are the people who can facilitate this. But there's no question that we have to tackle the resource needs, and those who are able to help make these decisions at global as well as at national or subnational levels, but also at service delivery. Dr. Bohan there was just talking about how, sometimes you might have services that are not accessible to certain components of the population, like young people, as I was saying. So I think it has to be. We just had the African Population Conference in Malawi in May, where we actually had MPs from about 20 African countries. Members of parliament are ready, and they came up with their resolution that highlights this issue of increasing resources for health, making family planning complete, all these issues. Now the question really is, how do we support them to provide the leadership that is needed? But it has to be all the people who are making decisions, who are at whether it's at service level. It's a cultural issue, the traditional leaders. So it has to be a comprehensive approach. That's what I would say.
Why do you want to think from?
Oh, absolutely, and I fully agree, Dr. Elia, and that's why in my opening comments I said women's health and everything that we're experiencing. Largely, the first point that I started off with was the socio-cultural aspect, right? Because this is dictating a lot as to how receptive people are to interventions, to ideas, to programs. As you rightfully said, you have naysayers, outright naysayers, or people who are maybe not too comfortable with the content of things, whether it's from the education level, whether it is from the religious leaders, and in different spaces, even within the healthcare system. Certainly when I worked in a rural setting as well, which was a more conservative Muslim community, which I am from, this was a hot topic. Contraception was a hot topic. And we started with the staff members ourselves, all the healthcare workers and the cadres as women, what are our own thoughts, right? And there was quite a disparity in what we know from our training and what we should offer to patients versus what we believe and feel ourselves and what we are experiencing as women. So there's also that juxtaposition. I think it was last summer, the Bill and Melinda Gates Foundation and the United States National Institutes of Health had sponsored the Innovation Equity Forum, right? Which came up with a report that has been released that's called the Women's Health Innovation Opportunity Map. And so this was a forum where there was over 250 experts and stakeholders representing 50 different countries and quite diverse perspectives across various geographic regions and sectors who work in this space under the umbrella of women's health. And so what they came up with was the Women's Health Innovation Opportunity Map, right? And they've identified 50 opportunities that are critical for catalyzing the innovation to improve the health of women. Now, it's not a one-size-fits-all. I think that is also the thing that we agree upon. And so the suggestions that are there always have to be tailor-made to the local context. I think this is a learning that we have. We cannot copy-paste, we cannot cookie-cutter solutions. They will look different from country to country, but also within a country from community to community, right? And so we have to have that in mind. And at the end of the day, I think we really need to be cognizant that we need to have, and it's very critical to have women have a seat at the table and join these conversations. So that the diversity aspect is not just from experts. Rhoda, you asked, who are the people who need to be there, right? Women need to be there. And so there needs to be a space where women can also express themselves and share their experiences, challenge, and also present the hurdles that they've encountered within my own household. Now, here in Africa, we have domestic staff. This is the conversation that I've had with domestic staff in, my siblings' household, my parents' household around contraception. What do they think? How are they? They come from a different socioeconomic category from myself. It starts close to home to actually really understand what are the challenges, what are the hurdles, what are the preferences, why. When we're talking about reproductive services for young people as well, their daughters, whether it's contraception, whether it's discussions around HPV vaccine. These are the voices that we actually need to bring to the table for any intervention, for any project, for any collaboration to really get the success, so that we can accurately and correctly support and champion the cause for women and for it to be successful. So I fully agree with what Dr. Elia said. And my addition to that is we need women's voices, and it cannot be cookie cutter implementation.
Maybe what I would add to that is just to say, yeah, I think, Doc, you keep talking about women's voices, which is so central. But I think looking at this, the underserved big group of young women, adolescents, I think they need to be on the table as well. I think they are the group where the least progress is being made. You look at even birth rates in many of these countries. There's not much progress over the last 20 years in terms of reducing teen pregnancies, and again, I mean, Africa can't achieve its full development potential if we continue taking this as something that can continue to go on. Yeah.
So I guess we also need to get more women into governments, which is in some countries already the case, right, on the African continent. But would you say that it does make a difference? What is your experience when you at Roche or Elia, when you were in discussions with governments in terms of getting the message through, and who is maybe more progressive than another country?
I think there's no question women are pillars of families, women are pillars of communities. And I think this issue about addressing the inequalities between men and women, it cannot be fully fulfilled if women, I think, as Dr. Bowen has said, are not sitting on the table to drive, to help find solutions. I think a lot of these solutions women know. You go to any village in Africa, the people who are going to be speaking about the needs of the community at a deeper level are women. And so we can't. So at decision making, we've seen countries where more women are going into parliament, more women are in government, more women should be in decision making positions in the private sector, but also in running their own businesses. A big part of economic empowerment of women is really the extent to which women are controlling resources and having a say on how the resources, whether it's at family level, at community level, or at national level, how these resources are being used.
And you mentioned innovation, just to jump into another topic now, and also to maybe I think it was a good bridge to the question from the audience, which says, you can see it, right? Rhoda and Ilya. So someone from the audience asked, do you think Africa has the capacity to pioneer a paradigm shift in addressing female health by thinking about innovative solutions and perspectives that wealthier economies have ignored? So everyone always speaks about leapfrogging, and the African continent can leapfrog. So can it also leapfrog in that sense? And maybe does it already do so in some regions?
Do you want me to go first,
Right.
Dr. Elia?
Yeah, you go first, Dr. Brian.
All right. Thank you for the question from the audience member. And Rhoda, I think you're tying this into maybe a broader topic that you wanted to bring in around innovation. Yeah, certainly even when I joined Roche a little bit over 5 years ago, it was the consideration for R&D. And so I'll give an example with the kind of global R&D projects that Roche undertakes as an innovator company, right? And I myself, since you talked about the experience within Roche, I myself am the first person to sit in this role, leading our clinical operations for Sub-Saharan Africa. And it was a decision that obviously the leadership made, where it was, again, the most competent person to get the role at the time. So this was a new space for the organization. And a lot of conversation around how do we leapfrog? What do we actually use within the African space to be able to achieve what we can achieve? And there were some skeptics, but it's good for conversation to have different perspectives, obviously, and consider risk parameters. But certainly there was also a lot of healthy discussion around what are the opportunities and what is the investment. So I really like Dr. Elia's constant messaging is, what is the investment case even for women's health, right? How do we utilize existing infrastructure to do that leapfrogging? And I can say, I think from a private sector perspective, we certainly do see the opportunities for innovation. So a couple of examples of how we have started to implement and thinking around Africa within, let's say, the R&D space. I'll start off with the R&D space because that's where I work most closely with. And so we have a focus on where the biggest data gaps are, right? And so this is more from a health equity perspective. And we look at investing in systems to support research for diseases that are predominantly affecting women. So we work, a big part of our work is within the cancer space. And so we have focused a lot on cancer of the cervix and breast cancer. We not only review our research study protocols to actually see if there's a fit within the local context, does it make sense in terms of the scientific data gap, but also in terms of applicability and operationalization. And what we also do is we think about, we talk about the patient journey. And so we look at the person, where they are, how do we take our innovation to where the person is? And so it would be the same perspective from a women's health angle is, for example, conducting our clinical trials, our clinical studies, where the patients go regularly for their clinical care needs, versus running our trials in specialized research centers, which are there all over the continent, right? This not only offers early access to advanced diagnostic and therapeutic innovation to patients, but it also then builds the capacity within those institutions and the healthcare system itself. So embedding it and then leaving it there and thinking of a long-term sustainability perspective. We also take into consideration then like the life of the patient, right? And this also looks at a gender differentiation. So whether it is general transport costs for patients, but also do we have to consider childcare costs for clinic visits for patients? This is how we inculcate in our R&D study protocol side of things. From a system perspective and a health system strengthening perspective, we are committed to supporting women's health at every stage, as I've already mentioned. So for example, in Kenya, we have partnered with local county governments for a women-centric cancer care system. And so this project is called the Empower Project. It's currently being adopted in other African countries, in West Africa, as well as a neighboring Uganda. But Empower in Kenya started in 2019 and is currently ongoing. It aims to achieve a more integrated approach to cancer care for women by building up health system capabilities, especially targeted to rural areas, right? Working towards how conversations and achieving standards of care and policy change, and then creating that opportunity for disease awareness and patient advocacy. The good thing about Empower is not only the sheer number of clinics that were opened, but also then over time, some of these clinics moved from being cancer screening clinics and the services advanced into treatment centers with diagnostic capabilities. And I think what has given us a lot of joy as the Roche team is also to see then those institutions utilizing these clinics and expanding and involving to screen even other chronic conditions like diabetes and hypertension. And because of the acceptability within the community, we are now going even beyond women to include prostate cancer screening. So it's more like a family visit. How do we come in? So that's one example of how we work directly within, let's say, our own internal projects and how we're interfacing as a health systems partner, and then thinking more broadly as to how do we show up, what can we do in our capacity as a private entity to come in and partner with the healthcare system.
Mm-hmm. Thank you. Since we don't have so much time left, and I promised her to make her join the discussion, I would like to briefly involve Berger Modungwa from UNFPA into the discussion, who is a policy expert, of course, working for UNFPA, and especially focusing on strategic partnerships, also with the private sector. So maybe that's a good moment to make her bring in. So maybe very briefly, Berger, if you could introduce you in one sentence, and in a few more sentences, maybe introduce your current work and your view on this topic that has been discussed. Over to you.
Thanks so much, Rhoda. I'm pleasure to be here. I will try to be as brief as possible. So first, with an introduction, my name is Berger Modungwa, Strategic Partnerships Analyst at UNFPA headquarters in New York. And I am glad to be a part of this conversation, particularly with the presence of the private sector, because I work in partnerships with corporations to advance sexual and reproductive health and rights in the workplace. We are doing a lot of work in this area in order to leverage the position that the private sector holds as an employer to millions of women globally in the work that we do. Typically and traditionally, we have partnered with the private sector on joint programming, leveraging resources, expertise and knowledge, as well as their innovation. However, we have also realized that there's a big opportunity for the private sector to mainstream sexual and reproductive health in their operations. So this could be in their direct workplaces, but also their supply chain. So we have recently also developed a policy paper to provide guidance to companies on how to begin to implement programming and policies in the workplace to support women. So on a very practical level, this would mean enhanced policies around paternity leave. It would mean creating access to services, counseling to GBV survivors, as an example. It would also mean in the supply chains in the factories, where a lot of products are made, and largely by a female workforce, ensuring that those employees have access to family planning, contraceptives, or whatever it might be. So in this guidance that we have developed, there are some metrics and indicators. I think at the start of the conversation, Dr. Bulan mentioned that, what is not measured is not seen, it does not get done. So these metrics for us are a way to engage companies on an area that they really already understand in ESG. Sustainability reporting is something that has really taken off. So we want to embed SRHR into that conversation because we find that a lot of companies are not addressing this. So this is where we are. I think it fits well into this discussion, when we are speaking about what are the new ways and approaches that we can adopt and collaborate on in order to advance the global women's health agenda. When we talk about closing the women's health gap, some of the big issues there are around menstrual health and menopause. So this work that we're doing is also to not only remove stigma, move beyond creating awareness, but also think about practical ways that we can make change on the ground for women and girls in an area that, we have data that says women spend 40% of their lifetime in the workplace. So really, it is critical for us to engage them at that level and to ensure that their employers are also engaged as they have a responsibility to them as their employees. Thank you.
Thank you. Do you have any thoughts or reactions, Rhoda, Delia, to what Darmer just said? If not, I would just say, these are very different perspectives, different layers, right, that we've been discussing. What you do, Darmer, is corporate, so also in established settings. Elia, you work a lot also with, with cases in rural areas and so with very local governments and local communities. And you, Rhoda, you have the view from from a global company that works on both levels, actually, I suppose, which shows again how multi-layered this topic actually is and how complex it is in the end. What I would like, because we only have a few minutes left, but what I would like to ask all of you is, what would you wish from the international community also? We are here sitting in Germany, in Berlin, or in Europe. So what would you wish from the international advocacy community and stakeholders across Europe in terms of support and contributing to advancing all of what we have discussed here in the context of women's health, and especially also in terms of family planning? Given, of course, that budgets are always limited, so maybe beyond that, in terms of collaborating closer, working more locally, working with local governments, and so on. Maybe a few thoughts on that would be great. And also to the audience, if you have any last questions that you would like to share here, please do so in the chat. So Elia, maybe, do you want to start?
All right, yeah, I can start on that. I think maybe as I jump into that, I should just the last question. I think one of the people in the audience asked whether Africa is really ready to lead the innovation. And I think for me, the point is that you might be aware of these exemplars in global health project that the Gates Ventures office, Bill Gates' private office, Gates Ventures, is running, where the question really being asked is, there are some countries that, despite what you might say, despite all the odds, are making quite consistent, sustainable progress in addressing these issues. So you see that countries, you look at a country like Malawi, one of the most severely constrained, resource-wise constrained countries, they are an exemplar in family planning. They are one of the countries that have made the most progress. Also, more recently in reducing birth rates. At AFIDEP, we are actually involved in one exemplar project where we are leading. Na Dodo, again, who is here, is leading that project, trying to say, what do we learn? And 5 countries were chosen to say, these are the countries that have made the most progress. What can we learn from them? I think, for me, that's the critical thing. But also the other issue is to note that Africa is flooded with a lot of fragmented innovations, but a lot of these are operating at small scale and not being done in a way that the evidence is being drawn to draw lessons on what can be done at scale. So I think that's a very, very critical issue relating even to the point that Rhoda, you are raising. How can the international community help? I think it's a lot of the research funding is coming from outside the continent. I think the focus, the policymakers around the continent are saying we are tired of hearing the problems. We want more evidence on how we resolve these problems. So I think this issue about really looking at all these, innovations that are there, promising ones, and how we bring them to scale will be very central. I think the other critical thing is also the issue about really drilling home the concept of more health for money, as well as more money for health. So we tend to talk about more money, more money, more money. But at the end of the day, the question is not just about getting more and more money. It's about how we reinforce efficiency. But that's the most difficult part. If you look at Kenya and say, okay, what is really the financing gap in the health sector in Kenya? That is not just about saying we need more and more money. The question is the health sector also is rampant with a lot of wastage, a lot of idle, even medicines, drugs that go to waste, they expire, and so on. So I think a big part of this has to be, how do we make sure that we do the capacity building or the ODA assistance to Africa that focuses on helping strengthen local institutions, local experts, and the local governments as well, take charge on these problems and find solutions for them, because Africa's problems are not going to be addressed by the Western funders or development partners who are there. If we continue with the way things have been going on, where there are all these big programs that are coming to Africa, most of them are being run by, the international organizations and so on. Very little local capacity being built, not only in generating and using evidence, but also in designing and bringing interventions to scale, will continue going around the same issues. So I think that's what I would say there. I think it has to be evidence-driven interventions, but the evidence has to be driven principally by the local institutions and empowering the local experts and the governments themselves to take charge of not only doing a more efficient service delivery, but also making sure that we are able to mobilize more local resources to help address the resource gaps. Thank you.
Rhoda, do you have a last thought on that?
Absolutely. Thank you, Rhoda. From where I sit and the work that we have been doing, but as a healthcare worker from Africa as well, that question always comes up: is Africa ready? Is Africa ready for innovation? Is Africa ready for all these technological advances? My invitation for everyone to consider is innovation has to be fit for purpose. So the challenge actually is on the innovators. It's not a question, is Africa ready? I think we have plenty of use case examples of where things have been tried, whether it is ultrasounds in hand, whether it is self-collection brush kits for cancer of the cervix, whether it is using mobile phone technology, mobile money transfer. Technology is there, but the innovation has to be fit for purpose. If we actually have that mindset shift, then we'll stop asking the question, is Africa ready? And what do we need to do? And also, it will shift the perspective of what can we do to help, rather and think about it as what are we doing to partner to actually get that vision that is attainable. From where I sit, I really actually believe that that vision is attainable even for women's health. Second point is there's a lot of work being done by different partners, but everybody is working in a silo. And so there's a lot of duplication of effort, but it doesn't culminate in actually moving things forward. So that working in silos, definitely we have to find a way forward to tear down the walls. This is one such forum where we're coming in with such diverse views, sitting in different spaces, but equally concerned and working towards similar achievable results. What if we actually came together to join forces? And finally, as Dr. Elia has also touched on, there has to be always with everything that is being thought of and implemented, the viewpoint of how this is going to be scaled up, the scalability and sustainability. I think we have to move away from pilot projects that don't have a long-term plan in place. We have enough evidence and enough projects saying we're trying this and we're piloting this, but then it just ends there. Fabulous papers and guidelines are put into place and published, but we don't really see things moving forward. So those would be my key takeaways. Innovation has to be fit for purpose. We need to stop working in silos, and there has to be a scalability and sustainability with everything that is coming onto the table. Thank you.
Right. Thank you for these final words. So I don't really need to do a recap here. There are still 2 questions in the chat. I see that Elia is starting to answer to the second one. So I would just suggest that if the person wants to have more details about it, we're happy to share the contacts of the speakers if you agree, and then maybe you can get in touch later on. And there's this one question on how to reach the continent to avoid the in the group and out the group. I think that's always a complexity in very different sectors or areas. But here again, I think we're happy to connect you to each other to maybe further discuss here. And I mean, it's a very complex topic that is hard to cover in 1 hour, but I hope that we got a few new impulses and a bit of inspiration. And we had these 3 very different views. If you want to about women's health and family planning and so on from a multilateral perspective, we're happy to connect. Same for Afidab's work and Roche's work on the continent. Would be very happy to continue this dialogue virtually or in person at some point. Hoping for the audience also to further engage with you, our guests, our main speakers here. If you want to keep what we updated or stay updated for on our activities, you can also follow us on LinkedIn, get our newsletter, where we'll also follow up on this discussion and see how we can continue discussing this in the upcoming months. So thank you to all of you. Thank you very much. Sorry for this 2 minutes over time here. And feel free to reach out at any time if you have any further comments or questions.